Have you ever heard your doctor say you can't have corticosteroid injections but 3 to 4 times per year, every 3 months maximum? You ever wondered why? That's what this video is all about. So let's jump right in. Why limit corticosteroid injections to 3 to 4 times per year? One, it causes tissue damage. I don't know if your doctor's gone over this with you, but these steroids weaken collagen in tendons, ligaments, and cartilage. And yes, that means the discs. Those are the discs in between the vertebra in your back. It also weakens the cartilage in between your knee, or really on your knees. On the lower part of the femur, we got that white slippery stuff. And on the upper part of the tibia of your knee, not to mention the knee cap, it has that slippery, slick cartilage. And whenever you inject into the knee, the back, or whatever, just think of this, it disintegrates that. So if you've got a pretty good gap in between your knee today, if you keep injecting, it's going to speed along the degeneration, the arthritic process. I've seen it time and time again. An x-ray of 2 years ago, and then they get 4 injections in a year, and the knee joint just gets smaller and smaller and smaller, and then next thing you know, you're bone on bone. How did I get bone on bone? Just wear and tear. Maybe, yeah, some wear and tear, but some of it is this major side effect. I want you to keep that in mind. Every time they inject into your knee, your back, your finger, or whatever, you're further damaging the joint. Well researched. Also, increased risk of tendon rupture. Can you imagine that you're walking along, you just got an injection in your knee, hey, feeling pretty good, and all of a sudden the tendon just goes, it just breaks. That's because it makes it more brittle. So that's why doctors say you can't have it that often, and that's why insurers won't pay for it as well. You don't want to do damage or injure a patient, but the truth is you are every time. It can accelerate that cartilage and joint degeneration as well. So it also has accumulating systemic effects, meaning, all right, you're injecting it into the knee, let's say, or the lower back. It doesn't just stay in the knee or the lower back. It'll go throughout your entire system. So it'll enter that bloodstream. Risks include elevated blood sugar. I want to talk about that. This is a risk. If you don't have diabetes, I've seen this case. If you don't have diabetes, after one injection, you may end up with steroid-induced diabetes that sticks around forever. So these steroids can cause diabetes. If you have diabetes, and I've heard and seen this many, many times, diabetics will see their blood sugars elevate to crazy high levels, 600, 700, 800, over 1,000, making your blood sugars go through the roof. It can do adrenal suppression. That's our stress hormone. So that kind of sounds good at the front. It brings the stress hormone down. But remember, we got to have adrenaline in order to have energy, in order to wake up in the morning. So these things can cause fatigue as well. And it's a steroid. Steroids are known to cause weight gain. It can definitely pack on a lot of extra weight. Long-term use is linked to osteoporosis, immune suppression, and it's not even on here, but this can also damage kidneys, which have to filter out all the toxins out of our blood, and liver. It can cause liver and kidney damage, and that's a lot of times why they run liver panels, just to make sure they're not overly damaging those organs. And this is another thing a lot of patients say as well. We get a diminishing return on our investment, meaning a lot of times, I do hear back, not always, but a lot of times that first injection, I hear back from patients, man, it gave me a month of, no knee pain. It was amazing. Or 2 months, 3. I've heard as much as I've heard of years sometimes. And that's a pretty amazing thing, I'll have to admit. That might even be worth a little bit of loss of cartilage, a little bit of damage to the liver, but subsequent visits, injections tend to be less effective. So if you got a year out of the first one, oftentimes people see 6 months on the next, still not bad, 3 months, 1 month, and then 2 weeks, and then like nothing. And then that's usually when they're calling me, like, I tried injections, they're no longer working. So that's the disadvantage of that is, yeah, it can buy you some time. And that might be a good idea to strategize with that. All right, let's do the injection, get you out of pain, and then let's think about doing some other things to work on that, right? So if the injections are a crutch, like you break your leg, it's good to have a crutch. But then what you want to do is heal your leg with the cast or whatever you're doing for the healing modality. And then eventually you need to get rid of the crutch, right? You shouldn't be on the crutch forever. And we talked about that, a shorter duration of pain relief over time. This is supported by clinical guidelines. So remember, the topic is why we should be cautious and only allow 3 to 4 per year. So most medical associations recommend, they also only recommend 3 to 4 times a year per site. I would say 3 to 4 per year. So you shouldn't get 3 to 4 in your left knee and then 3 to 4 in your lower back. Like, the accumulating effects are going to do some damage on liver and kidneys. Okay. Based on long-term tissue preservation and minimizing systemic effects. So that's why we want to keep it limited. So yeah, if you'd ever wondered why we only limit it to 3 to 4, because it does harm. And right, we just don't want to do any harm. So I like this as well. This is what I was talking about. See what you can do. Maybe consider a strategy to use the crutch in the beginning. Get an injection because your knee is killing you, but then let's do physical therapy. Let's combine with maybe decompression therapy, other types of physical therapy, rehabilitation, muscle strengthening, maybe an anti-inflammatory nutrition. Hey, I always love nutrition, but whatever you can do, just keep in mind this injection, this should only be a short-term strategy. Let's use this until we can fix the underlying problem. We really want to focus on structural correction, long-term healing. So with regard to knees or back, we might want to look at orthotics. We might want to look at chiropractic care. We might want to look at personal training, physical therapy. We might want to look at, I'm just going to say it, maybe even surgeries to correct things. But we want to fix those underlying structural issues, get the body working better while we're doing that. Well, I'm pretty sure that's the last slide. If you have any questions or you have any comments, I'd love those if you leave that down below. What experience have you had? Do any of these ring true for you? 3 to 4 a year, is that what you get? Is that what you've noticed? And put it down in there. My first injection gave me 3 months, gave me 6, 8, 12. Let's see who the record holder is. All right? I hope this helps. Make it a great day.